so that we can discuss our community's response to COVID-19 and just stay updated with how we can be a part of solving this large problem. So let me open with prayer. God, I thank you for these incredible leaders who have taken time out of their day to come and communicate to us how we can best be a part of the solution to this problem. Would you give these leaders wisdom and energy and courage in this time of need? And when we fail to follow their leadership, would you convict us and give us courage to do what they ask us to do, even when those are uncomfortable steps for us to take? To those people in our community who are experiencing fear and anxiety, would you give them peace? Would you give them hope? God, we believe that you are the great physician. And so we pray that you would touch them miraculously, but also that you would guide the physicians in our community, that you would give them wisdom and insight and knowledge and creativity to solve this medical problem. God, would you please place your healing hand on our community? Be here with us today. Give us the words to speak. In Jesus' name, I pray. Amen. Okay, let me meet today. First, we have Chairman Deej Reardon. He is the chairman of the board of the Campbell County Commissioners. We also have Mayor Louise Carter King. She is the mayor here in Gillette, Wyoming. Dr. Attila Barabas is the chief medical officer and urologist at Campbell County Health. Dr. Ian Swift is the chairman of the Campbell County Health Board of Trustees. And then Mr. David joining us here today. Let me begin. I'll ask Mayor Carter King, before we begin, is there any words that you would say to those who are watching today?
Well, I would like to comment on a few things that the city has been getting comments on. There's been some resident concerns that we've been receiving regarding certain city services that have been suspended: electricity, garbage, solid waste disposal, and wastewater services. Currently, staffing is done to limit employee interaction with the citizens in the community, but also other staff. By keeping staff separated and working from home or working in isolation, we are able to limit or prevent any infection of staff. We are also taking measures for those that need to be at city facilities, like our wastewater employees. The wastewater split shifts to limit their exposure to each other. This also happens to be the location of the yard waste site. City staff is required to inspect every load that comes onto the yard waste facility to minimize contamination when loads are dumped. Also, when customers pick up compost material, there is an exchange of customer contact information for billing purposes between staff and our customers. Exposure to critical city staff that we need to continue the operation of our wastewater facility. These are staff members that are required to have special training and education to perform their duties. We cannot have them getting sick. The same goes for our snowplow drivers and vehicle maintenance people. We need them ready to go when we have a snowstorm. As much as we would like to have the scoria cleaned up, these employees, by bringing them together to clean up something that we can take care of in a few weeks when the chance for a large snow event is lessened. And hopefully we see a downward trend for the number of cases in our region. So thank you, Pastor Wilson, for giving us this opportunity to speak tonight.
Absolutely, thank you. And let's just hope we don't have any more of those big snow events this year. Just one year, none this time of year. Let's hope for that. So we received hundreds of questions in preparation for this town hall from our community, and we've narrowed those questions down to the most asked questions. And we didn't get to all of them, but we got to most of them. So I'm going to ask this one to you first, and then if anybody else wants to join or to answer this question later, because I think it's one of the bigger questions, feel free to add your thoughts after Chairman Reardon does. President Trump has said that there is light at the end of the tunnel on the national level. Would you agree with that assessment on our local level? Unfortunately, Wyoming just had a death due to the illness, but it appears each day than we were at the beginning of the month. That's 9 to 10 per day seems to be less than it was at the beginning. So what would you say about our position on that bell curve that we've been trying to flatten out? Are we on the upward slope or the downward slope?
Well, thank you, Pastor Wilson, for inviting us tonight. We do appreciate it, and we appreciate the efforts that you guys are doing to keep the public informed. I'd like to start off by saying I think it's too soon to say that we've peaked a curve and are on the downward trend. We have not taken a lot of tests in Campbell County, and the number of people that may be infected could be much higher than the 11 that we have currently recorded. The good news, the Wyoming Department of Health and the Campbell County Public Health fully anticipate Campbell County will continue to have more labs confirmed, or lab confirmed cases arise, excuse me. The rate at which the positive cases present will be determined by how well the community follows the guidance provided by the Governor Gordon and State Health Officer Dr. Harris. The infections that a New York City would see, because we just don't have that many people. But we also don't have the hospitals that they have to take care of the sick people. So it's our concern that we do not overwhelm the healthcare system, and we maintain our physical separation of 6 feet, stay home when we can, stay home when you're sick, covering your coughs, sneezes, and regular hand washing to preventing the spread of COVID-19. But we also don't want to see a real peak where we overwhelm our hospital. So I guess that's what I'd start with. Thank you.
I agree with every word that you said. And I definitely think it's clear that really the responsibility lies within us and all of the residents of Campbell County to make sure this curve flattens. And it's going to be our behaviors over the next few weeks that can dramatically change the need for the hospital to be at a peak level or overwhelmed. So certainly we're off to a good start. Our exact position on the curve is unknown and may even be unnecessary to know at the moment, because really what we need to do is exactly what you just mentioned: continue practicing mitigation behaviors that are going to flatten this curve no matter what.
Thank you for that, Dr. Swift. Anybody else want to jump in on that one? All right, I'll ask Chairman Reardon. The question we got by far the most was specifically, when are you going to reopen businesses, and when is it going to be safe to go back to work? And we got individual questions about a lot of different industries that people are wanting to open. Say that there are criteria that we are looking for. How will we determine and know when it is time to go back to work?
Thank you, Pastor Wilson. That's a decision that will be made by Governor Gordon and Dr. Harris. The decision to open up businesses is not going to be like throwing on a light switch and everybody just all of a sudden on Monday mornings takes off where we left off. It's going to be slow. It's going to hopefully sooner rather than start. And we are starting a plan to start opening up businesses, but at what point, we don't know. This curve that we all talk about, and flattening the curve and not going back into a condition where we cause a resurgence is really critical. In other states with less severe outbreaks in New York, Dr. Fossey said that at the end of the month, we can look around, quote, reduction in cases and don't pick up any more new cases in Wyoming. I think we can start looking at those things. And I think that the governor will have a big say on that. Well, he'll have the say on that. The U.S. Department of Health and Human Services projected that lifting states' extreme containment measures, like the things that have been in Wyoming, such as ordering residents to stay home and closing schools and non-essential businesses, of how we open things back up and get businesses going. We know businesses are suffering. We know they're doing their best to keep their employees on. There's a lot of programs out there through the federal government and the state government that we can do to help people. But I think we also have to be cautious so that we don't have a resurgence of this after 30 or 60 days. So I'd ask anybody else to add into that. Thank you.
I think most of us would say a big amen to that. Let's make sure we get this taken care of in one shot, if at all possible. I know that on a national level right now, we're having the conversation of whether or not it's the president or the governor who gets to make this decision. I appreciate your clarification on that. One of the questions we got a lot about is kind of self-judging our local response. And we had a lot of people whose questions seem to say they feel like we're overreacting, we're doing too much. And we had a lot of questions of people who say we haven't shut down enough and we haven't created enough rules. So Chairman Reardon, I'm curious if you would give some follow-up insights into that. Do you believe that our response to this has been too slow, too fast, too little into the crisis?
Well, our local response was driven by the governor and his statewide orders. I think his timing was appropriate. I don't think that we waited too long, and I don't think we pulled the trigger too soon. Some people would argue that we did not react fast enough, while others, an equal number of others, would say that the state and local officials have overreacted to the situation. And just purely based on numbers, both of them would have on the healthcare system while still allowing businesses and activities to carry on as much as possible, and also allowing people the freedom to do what they want without government overreach. We don't want to tell people what they can and can't do, but we also don't want people to end up in the hospital, and we definitely don't want to jeopardize our healthcare workers and overwhelm the hospital so that they can't do their job. So I can answer that. Thanks.
Very helpful. I received multiple people sent me this study that showed that Wyoming was worst in the country in terms of obeying the social distancing guidelines. So I went back and I read that article that I kept getting tagged on Facebook, and they used cell phone signals to figure out how many people had gathered in one place and how far different cell phone signals had traveled and how much time people were spending at home. So Mayor Carter King, I'll point this question to you. How would you grade our local obedience to the social distancing guidelines and standards from what you've seen in our community?
Well, I think we've done fine. As we all know, here in Wyoming, we have wide open spaces, and large numbers of our residents have to travel quite a ways for work, whether it's in the coal mines or the oil fields or other energy sectors. Our ranchers have to drive a long ways to either come into town for their supplies. It isn't hard to believe that that's what the data shows when they look at our cell phones, just because so many of us have to travel so far for work. And recreating is the same. We have to travel a long distance to go recreate, and it is possible to enjoy the outdoors while still following social distancing measures or guidelines. So I do feel how far we have to travel for work and recreation.
That's helpful, and that seems logical to me as well. So social distancing has just become a part of our everyday language, which I had never even heard of, the idea of social distancing. I'm a pastor, so we talk about social community and all that all the time. And so this is a new thing for us, and it really has become our primary tool. But Dr. Swift, I'm wondering if you would reflect more on the big masks or not shaking hands or taking baths and hand sanitizer or whatever it takes so that we can reopen the restaurants and schools and all of that.
That's really a great question. The one thing I will say is there's no way we're going to get out of it. We're not getting out of it. I certainly think we're going to get through it. This community, this country, this nation, and in fact, unfortunately, this globe will get through this. And we're not going to go normal. I do think a vaccine is the game changer, but that's not here anytime soon. So we need a solution sooner than the 12 to 18 months that a vaccine could be readily available and safe to utilize to protect our citizens. So I do think this new normal will include some social distancing, unfortunately. I do think, as Fossey said, this antiquated of shaking hands might be. Because if you put your hand out there and you shake a hand, you might be bringing something back home. So, I mean, I think these are things to think about. I think distances at work will change. I do think hand washing is going to really impact the flu season next year. The things we learned this year are going to implement change in our society that's going to affect respiratory viruses going forward. So I think the new normal is what we're going to try to approach. And I do think the vaccine is a game changer, but I don't want to wait 12 to 18 months to have this opened up and have us going back to restaurants, even if that means that we're only in limited seating at some of those restaurants. So I think it's the time for entrepreneurs to think out of the box, to supply systems and a future that looks different, but will be safe for the residents of Campbell County and the residents of this world.
I really appreciate that. I appreciate the optimism. Us as leaders have got to be asking the question, what does it look like to lead in this new normal? And so I'd ask you that, Chairman Reardon, I'd ask you that if you could kind of do some reflecting about the schools, if we're talking about not waiting until there's a vaccine. We're going to have school before there's a vaccine, at least, if not this year, at least next year. I'm wondering if you could kind of reflect on the decision-making process about when school is canceled, who makes that decision, and how do they make that decision?
Well, that answer or that question should be directed to the school district, but I do talk to the school district on a regular basis, and the school district's decisions to close the schools was made in conjunction with the state school superintendent. There is the question, you know, of a lot of people of, well, we had a 2 or 3 week break in schools and now we've got our kids back in school online. And I think that question is online learning and packets containing different materials for study. After 1 week of implementation, it appears that most students are having success. A few students have had some technical issues, but they've been able to work those out quickly and hopefully have most of their students working without trouble. What we are hearing is that most students are enjoying the program and are glad to be back in some kind of educational setting. I have grandkids, schools not to open up the buildings because my wife was a school teacher for a long time, and everything that was brought into that building, it seemed like she caught for the first 2 or 3 years. After that, she became very immune to most everything that was brought into schools and was never sick. But the COVID-19 virus, if it gets into a school, it's going to travel and it's going to travel fast. It could infect a good majority. It'll be back to normal. Whether they come back into schools or into the facilities before the end of this school year we'll wait and see based upon the governor's direction. But the governor and the superintendent schools directions. But if they do, the best would be the 1st of May, and then they only have 3 or 4 weeks and school's out. So I would say the adaptive learning is doing.
Appreciate that, and I appreciate that title, adaptive learning, because it seems to me like our school system did a really good job of coming up with a solution to a problem that seemed insurmountable just a month ago. So we appreciate them on that. I'll ask you, Dr.
I would like to add one more thing in there as far as the schools, and I don't know if a lot of people that have kids understand it, but the schools have also been providing free lunch and breakfast for these kids. I think their last count, they're serving over 2,000 kids free lunch, free breakfast. So it's very commendable of the schools and what they've done in order to keep those kids fed. And if you drive by various schools around town, and there's quite a few of them, there's a bus sitting out there, and they are providing free breakfast and free lunch for those.
Absolutely. That's a tremendous service, and I'm really glad they came up with that as well. Dr. Barabas, we're talking now about down the road, possibly next fall, and we've heard about a second wave that could come, and for many of us, that's just an overwhelming thought. Is there a chance that we're going to have to do all of this again, shut down in the fall when a second wave hits?
So, as you know, everywhere in the country, the wave that's hit upon us is different in every location, and there's lots of different factors that go into that: size of the community, the amount of travel that's there, the population density, that kind of a thing. So as we turn greater activity, and so what that does is it allows people to start bumping into each other in a little bit more frequency. And since that virus is not necessarily defeated over this time that we're trying to flatten the curve, it will likely result in a second wave. Ideally, because we know what to expect, and we are hopefully taking into account that we're increasing interaction, that we can help mitigate the size of that second wave. So having to go back to the tight restrictions that we have now is probably pretty unlikely. Most likely we would, as Dr. Swift had said before, there's this sort of new normal that we're going to probably encounter, and that will help mitigate that wave from being sort of overwhelming like we see in parts of the country like New York and Louisiana.
So if you had to guess, does that second wave happen because the coronavirus mutates and now people that were infected with a previous version of it are now infected again? Sorry, I'm talking way over my head. Or are more people getting it because they weren't actually immune the first time they got it? Or it's new people getting it that didn't get it the first time around?
Yeah, so the nice thing about coronavirus, if there's anything nice about it, is it actually mutates at a much lower rate than, say, the flu virus does. So the thought is that once you've been exposed to the virus and you've gotten over it, you should have probably a 1 to 3 year immunity is sort of the minimum. And so if you've got the virus already, you should not get it again. The issue is that there's a lot of people in the community that have never been exposed to it. So, there's there's examples all over the country, but for example, last month in Washington, they had a church group that got together and they decided to have a choir practice with the understanding that there's this coronavirus out there. And out of the 100 people that were supposed to show, about 60 ended up showing up. They were very careful. They didn't shake hands. They used hand sanitizer, but they estimated at least one of sure enough, as the beginning of April, approximately 45 out of those 60 were infected, and at least a couple had already died at the beginning of the month. That sort of shows you just how aggressive this virus can be, and that if we really sort of take our foot off the pedal and we get too lax with our restrictions, it can spread very, very quickly. So the big risk is really those people out there that have never been exposed, and then allowing situations for them to come in contact too easily and with a real high density of people, that we want to avoid that.
I'm assuming that when we have more experience to treating it, that down the road, we would have a better idea of how to treat it when a second wave hits as well. Dr. Barabas, there's some controversy surrounding a few potential medication. It seems like.
Yes and no. Per FDA, we have very specific guidelines as to what is recommended for all sorts of treatments. So we know that there's no FDA-approved drug that can necessarily, for sure affect the outcome of someone with COVID. However, we use a lot of medications with the term off-label, meaning that some medications that are out there we may be approved for one condition. A really good example of this is hydroxychloroquine. This is an anti-malarial drug that is FDA approved for malaria treatment, but it's not FDA approved for COVID treatment. There's medication being used in around the world right now, for example, along with other medications. You may have heard of azithromycin. There's also antivirals that are used for other virus-related illnesses that have been hopefully are being applied to the treatment of COVID. There is probably some of these that do work. Have to be careful with these. We're introducing side effects to a patient for a medication that may or may not work. So right now, a lot of these drugs are being tested. I think there's a good probability that we will find that some of them have benefit, and then we'll be able to use those in the appropriate patient at the appropriate time.
We'll talk more about testing later, but I just wanted to mention the antibody test. We've heard about speeding up the tests we have so that we can get results more quickly, but it seems like the antibody test actually provides more help than just that. Is that something that you've seen any progress in?
There are, from my research, there's dozens of antibody tests out there. And just to sort of differentiate what an antibody test is to compare to what the typical test that's being done right now, the current test tests for the actual virus itself, and that says if it's positive or negative. The antibody test measures the body's immune response to an infection. So it tells you, are you potentially currently infected, or have you been infected and you have built up an appropriate antibiotic against that? The problem is that with all these dozens and dozens of tests that are out there, we don't know the accuracy of those tests. There's several that are very promising, and as they become accurate and we know that they're accurate, then we can start identifying potentially patients quickly active and those that have had the virus and are now immune. And that could then translate to very large scale testing of the community if that was felt to be the appropriate thing. So there's definitely promise, but we need to let it mature a little bit before we really implement it on a large scale with the believability that we're actually identifying patients that truly have been cured from the.
We had multiple questions come in about whether weather change or seasonal change or heat combats this disease. Can you speak to that at all?
Yeah, so we know that warm temperatures increase the humidity, which helps the pulmonary system. Your lungs work better in it, so that helps defend against viruses. And it also, that certain viruses tend to be less resilient in a warmer, more humid environment. The problem with the coronavirus is that we do not know if it has that same susceptibility as you. The hope is that we do, but the general consensus is that while we hope that it will decrease the virus's capability of spreading, don't plan on it and use other measures.
That's helpful. Appreciate that. Mayor Carter-King, we're going to turn a corner here, and I want to talk about the economy. I understand that the oil prices are negatively affecting our economy, and that's kind of another outside force that's affecting this. But how much do you think coronavirus itself is affecting our economy?
Well, obviously, it's negatively affecting our economy when people can't go to work, restaurants can't open, and all the other businesses and industry that aren't working. But to add to the misery, we also have such a downturn in oil prices. So our energy sector is also getting hit. So Rick Mansheim at the Wyoming Workforce Services today, they're not the unemployment office, that's in Casper, but they do help refer people there. And they said that normally they see 35 people per day, with about 25% of those leading to a referral to the unemployment office. Now they're seeing 80 to 100 people per day, with 90% of this, and they're taking 180 to 200 calls a day. So they are, of course, overwhelmed. And I think that's what we can say about our economy, is that it's overwhelming what it is doing to us while we're fighting this COVID, plus the downturn in prices of energy.
Do you know if the unemployment office is able to keep up with the demand?
Well, I think they're doing their best. So okay. It's just hard to say, because they're taking 80 or 180 to 200 calls a day. That's probably a lot of busy signals for people that are trying to call in as well. So I just think they're doing their best to.
If you had to predict how the long-term effects on our economy, do you think, seeing what you've seen in downturns in the Gillette area specifically, do you think this is one of those that will return quickly? When we can kind of release some of the social distancing guidelines? Are we going to bounce back?
I think it's going to take a while to get back. Hopefully we won't lose too many businesses, but for a small business to have to shut down their business for as long as they've had to in this turn, and how long they may have to again, and then restart and get their employees back. This one is a tough one. I know anyone who's lived in, seen a lot of booms and busts, but this one in 2016 when we had all the energy layoffs, but this one is a whole nother level of just, it's going to be a tough one. I would hate to say that, oh yes, we'll all be back as soon as we not work, because it's going to take a while. We'll do it. Gillette always comes together. Campbell County, we'll get back. We always do, but it might just take a little longer than we're used to.
Gillette strong.
That's right.
Dr. Swift, I know one of the businesses that are struggling around the country, and I'm assuming locally, is the hospital. I know that many medical procedures have been delayed, and as a result, can you kind of give us an idea of how that's affecting our?
Sure. I mean, every hospital system, no matter how large or how small, or I should say healthcare system, no matter how large or how small throughout this country, is going to be very negatively impacted by this. There's some concern that 5 to 10% of hospitals in particular throughout the country won't weather this storm and will not keep their doors open without significant aid. The rural hospitals are even going to be more aggressively with less funds and to offer care. So rural hospitals in Wyoming, there's certainly a few of them that are really in jeopardy. I would like to say, and certainly it's true, that CCH is well positioned. You know, we've been smart over the last few years to make sure that we had adequate money on hand. So we aren't going to close our doors. We're going to be able to make it through this moment. But this will significantly impact our industry and our hospital.
Is there any foreseen layoffs on a large scale that you know of?
Well, the two big things that are out there that I don't know that we really need to know is how long is this going to go on? What is the length of this? Because every month that we roll by, the amount of debt we take on, the amount of cash that we have to burn through goes up significantly. And also, what's the government aid going to be like? Yes, they're talking about this government aid and $1 billion coming to Wyoming. You know, the CCH family is 1,200 people strong. And I'd like to see all of those people be employed moving forward. However, without knowing how long this is going to go on and with what type of aid we'll receive, it's hard to predict exactly what will happen, but we will make all the best decisions for our family and for the residents of Campbell County.
Yes, amen to that. We got a lot of questions about testing. So Dr. Swift, I think locally we've tested just over 280 people on a local level, and we keep hearing about an increase in the number of tests available to us. Are you expecting a large influx of tests at any time?
Yeah. One thing I've learned is to not expect anything, especially in this sort of situation. The number of tests that Campbell County Health, as well as Wyoming, were given was inadequate. And it was inadequate because those tests needed to go to hotbed areas like New York, Seattle, California, and they weren't able to come to Wyoming. So we had to be very judicious with our use of tests. And we followed the Wyoming Department of Health test. So the only way to really combat this virus is large-scale testing and then isolation of those people that test positive. So I do expect that to increase, especially as New York, the pressure in New York, potentially California, Seattle begins to decline. Then there have been made promises that reagent is coming in here so that we can do our tests in our own lab. These antibody tests are in the next few weeks. That might be a little bit more testing is coming, because we would love to test everybody with symptoms. We would like to know right away that you have it so we could say, okay, go please isolate yourself for 14 days. Because the only alternative to that is, I'm sorry, we can't test you, but this really sounds like what you have. So what's most responsible is for you to isolate yourself. So until the tests increase, and they are slowly increasing, but I think it's weeks yet before we have all the tests we desire.
Could you talk a little bit more about how you determine who does get tested? We all know somebody who has been told they have it or probably have it, but yet they can't get tested.
Yeah, that's a very good question. We don't determine it. In all honesty, we're following the recommendations of the Wyoming Department of Health and the Wyoming Public Health Laboratories, who it does not meet the criteria, it sits on their table. They don't test that particular sample that's been sent to them. So the test criteria are quite specific, and they've been loosened a little bit now that we've had increased tests available. But CCH does not set that. We follow the standard. And we've all talked about that. Those tests are hospitalized patients with fever and respiratory symptoms. It's risk for a bad outcome from COVID-19 are being tested. Healthcare workers that are on the front line, we need to know if they have symptoms, if they need to be separated. Pregnant women that have respiratory and fever symptoms are tested. And the criteria are quite strict. And we follow that criteria. We expect them to be loosened as more tests come in. And hopefully in the very near future, if you don't feel well and you've got the fever, reality right now. I wish it were.
Yeah, and could you speak to the accuracy of the test? We've got one question from somebody who said that she was tested, she was negative, and then has found out since then that she actually does have it.
Yeah. Yeah, that's a great question, because I'll tell you, whenever you roll out tests like this at this speed and there's this need, there's no way you can have 100% accuracy. I hear that number out there that the PCR test, and that's the most common test we're doing, and that's the test we're doing down in the state laboratory, is about 90% effective, 90%. And that's a pretty good number, but you're going to miss some. You're going to have some that comes in today and they're negative, and if you've diligently tested them tomorrow, maybe they I'm not worried about the veracity of the PCR test. I think it's a good test. I'm more worried about some of these kits that are being sold on the internet or by vendors that are not reputable, that hospitals and healthcare systems can pick up. And there are going to be a lot of negatives that aren't. And that's a big concern.
And Dr. Barabas, so for those people who have been told that they have it but have not been tested, can you give them an idea of how worried they should be about having it? Do we need to know we have it or not because there's some kind of long-term effect of this disease?
Well, right now, you don't necessarily need to know if you have it or not. You really just need to follow the guidelines. So if you feel sick and you're having those symptoms of COVID, which is, the fevers, flu-like symptoms, cough, runny nose, you need to self-isolate. And the CDC guidance, along with the Wyoming Public Health, is that you need to be at home for a minimum of 7 days from onset of your symptoms and at least 3 days after you no longer have symptoms. If you follow those guidelines, you're essentially A-OK at home. If you start getting less well and you start having breathing problems, then you go to the emergency room and you're treated just like you normally for having diagnosis to know that you have it, because it's going to be treated the same essentially.
Okay. And Dr. Swift, could you describe to us what does our hospital look like right now? Can you give us an idea of our hospital's capacity? Are we getting close to it? Have we experienced any capacity issues?
Yeah, one way I'd like to answer that is, as you know, it wasn't too long ago, we were in the midst of a cyber event and a pretty devastating month that we had to go through and journey through. And boy, what a coming together of the team of the CCH staff, administration, employees, physicians, nurses, EVS, that came together in that particular moment, got themselves to a level of preparedness. They're calm, they're ready. The thing that concerns me the most is how fatiguing this is. This has been gone on a while. There was a lot of unknown uncertainty. They had to weed through that, figure some things out, and now everyone lies in wait to see if there's going to be a surge and are we going to have capacity. Well, the truth of the matter is we haven't had a lot of inpatients. No one's been on a ventilator. There's no one currently in-house with COVID-19. Our capacity is quite good, and capacity is quite a few things. It's number of beds. It's the personnel that can then take care of the people that are there. It's having the supplies and the equipment that's necessary to take care of these patients. And right now we're not taxed. And if we can continue with social distancing, isolation when you're ill, doing all the proper mitigation steps, hopefully the hospital system never becomes overwhelmed. And that's our easiest way out.
And so I'm assuming you answered this question a little bit, but we did have a few people ask about when are those other medical procedures going to be rescheduled?
Boy, I hope as soon as possible. That's one thing I can tell you. I mean, CCH's goal is to get through this and then to continue to the excellent care that we provided every day to the residents of Campbell County. And I hope that's soon. And really, I don't think there's a way of knowing that until this curve flattens and we see our surge go through. You don't want to utilize capacity being supplies, personnel, elective procedures when you're going to perform. But once that looks like we're on the other side and we're continuing to practice the mitigation principles that are necessary, yeah, I'd like to see us open back up to performing some of the procedures that we do, doing the outpatient services that we do, because there's a lot of people in town that are putting off treatments that they need, that they're in pain and they're uncomfortable and their knees hurting, their backs hurting, they need to get in to see their cardiologist, whatever it may be. We need to return to being the hospital system that we have, the healthcare system that we've been for so many years.
And we appreciate you guys even more than you know it, I'm assuming, because you guys are doing a phenomenal job. Dr. Barabas, I'd like to turn a corner here slightly and talk about safety precautions that we can and should and are taking. I don't know about you, but I've gotten a lot of emails from people. It's a video of a doctor saying, if you will just take this medication or if you will just take this supplement, then you will be fine and you won't get it. Could you speak to that? Our immune system or protect ourselves from COVID-19?
Yeah, so definitely it's sort of a buyer beware. Any of these events like this really can bring out some shady characters. So you have to be careful. There's nothing that is scientifically been shown in terms of a supplement or home remedy that will help necessarily prevent you from being ill or sleep, eating good food, maybe taking a multivitamin. If you're a smoker, this would be a good time to stop smoking or seek help for that. Limiting your alcohol intake. And then I would say probably the two vitamins you want are vitamin S and H, you know, social distancing and hand washing. Those are the things that you can probably do.
That's good. And we've heard conflicting information about face masks. Should we all be wearing face masks?
So yeah, that's been a pretty well debated topic, and you know we see a lot of the Asian countries wearing face masks, and it probably limits the spread to some degree. So when we talk about the masks that are recommended, it has come out by the CDC to say when you're out in public you should wear a mask. So now they've added to that if you're out in public, you should also wear a mask. What does that do? Does it protect you from others? Not necessarily. The biggest thing it does is that we know that there are asymptomatic carriers out there. That means there's patients that are people that are infected with the virus, and they can be shedding a viral load without knowing that they have the virus because they have absolutely no symptoms. When we talk, we actually will have droplets of fluid that can travel out to 4 to 6 feet. That's part of that social distancing aspect. But when you're at the grocery store, it's hard to sometimes maintain that. And so having one of those asymptomatic carriers can help block those droplets of fluids from potentially being expressed out of your body, and you would then protect others. So I think that it is actually a good idea to wear a mask in public, just for that reason.
That's helpful. It makes me curious if the coronavirus is spread through the air or by touch, because if it's through air, then you wonder why should we wash our hands, and if it's by touch, you wonder why would I wear a mask. So is it both, or how does that work?
Yeah, it's both. So when we talk about spread with the coronavirus, we talk about droplet, and that's that where I sort of said when you cough, sneeze, you have little droplets of fluid that fly out, and they can travel several feet. And then there's sort of airborne, which is the thought, it's almost like a smoke, you know, if you were to sort of think of the virus, a cloud of virus. The things that we can do to prevent that transmission, again, is wear masks to help prevent the droplet, social distancing, and then also the contact is from basically if someone transmits the virus through coughing or sneezing onto an object, you're going to touch it, and then as humans we tend to touch our face a whole lot, and we allow for that virus to come into our body in that fashion. So that's where the hand washing part's in. So it's really a two-pronged approach.
Mr. Sanchez, I'm wondering if you could kind of be the eyes and ears of those of us who've been stuck in our houses for a long period of time and we haven't seen the real world in a while. Could you give us an idea of how many people, being at Walmart, I'm sure you see a lot of people still, even though there's fewer people, how many people are taking these safety recommendations seriously?
Well, we're seeing it grow more and more every day. You see the face masks more and more every day now, especially with the new recommendations. So I think that Gillette as a community is doing their part to really help with that.
And what steps are you as a store taking to help with this issue? Do you guys have rules about overcrowding and congregating in the store?
So yeah, there's a lot going on right now. We've reduced some of the services right now, like food demos, our auto care center, our vision centers are all closed right now, just to give those associates more time for cleaning and sanitizing, helping with stocking. We've teamed up with Heart Brand backpack sprayers to help sanitize all the carts a lot faster now. We actually spray them down with sanitizer. We've increased the pickup and delivery service options for customers to help minimize contact and maintain social distancing. We've installed those barriers. We've also included taking the temperatures of our associates as they report to work to start to make, and we've made gloves and masks available as well to associates who want them. So lots going on. We have the inside the store to help. We are working on, we've put the social distance reminders up throughout the facility as well, just to remind that public about that 6-foot spacing.
I appreciate that. One person in our community sent in this question. He said, when I went to the store during the senior citizen hour, there were many people who appeared to be far younger than 60. Is there anything that the store can do to enforce these restrictions?
Well, you know, our committee's been really good with that. We haven't had much of a problem with that at all. I'm here every Tuesday morning greeting them as they come in the door. We have our folks out there at the door monitoring the count as they come in and just reminding customers that it is our senior shopping time. So we just do a lot of reminding, and we've had folks that, oh, I'll come back later, and then they leave. So I have an issue with that.
It's good to hear. Actually, one of the questions that we received most, and it's surprising it has taken us this long to get to it, I know, but one of the things that's causing a lot of anxiety is the fact that grocery stores and other stores are running out of food and other merchandise. Do you have an idea of when the stores will catch up with demand, when the shelves will be restocked, or is this a long-term demand problem that we're dealing with?
Well, we're starting to see a much better flow right now. We've lifted the limits on many of the items right now. Before we had, you know, through milk and eggs, we have limits on all that. All that's lifted now. The biggest demand still is on some of the cleaning supplies, the sanitizers. Those limits are still in place. And then just different items depending on their type of supply chain. We'll have some fluctuation, of course, with this virus. Some of it just being as simple as having drivers to deliver. And some of it may be manufacturers that are shut down or different businesses like that. So it kind of just depends on the type of product, but we are working real hard to get those shelves restocked as fast as possible, and you are starting to see that come back into the stores now. So some of that's going back to.
And I was in there just the other day, and it didn't seem understocked to me at all. So I was a little surprised by that question because I had seen quite an improvement, and we appreciate that. We're going to transition now to talking about the needs of our community, because really that's the impetus for most of this. And I'm wondering, Mr. Sanchez, if you would give us an idea of how you feel like our community is weathering this storm. How have you seen people pitching in?
Looking for all the blessings that happen during times like this, from just customers who would, just so they don't have summer diapers, something along those lines. We've had different businesses, individuals, schools, bring in pizza, donuts for all the stalkers, schools that wrote letters of thank you. So I got to say, I think as a community, we're very blessed to be in such a great community. From that, there's that Facebook group, the Campbell, Coverage of Campbell County, that's just really doing a great job of helping each other out. And I just, you know, we're just really blessed with that. So just thank you to all you customers out there who have taken the time to tell our associates thank you. Gillette, we just really appreciate it. So thank you, thank you, thank you.
It's in times like this that we really start to see who the heroes are, the ones who are willing to do the hard work when nobody else is, even when it's more challenging than normal. So we appreciate everybody who's doing that. Mayor Carter King, we're going to conclude here by kind of talking about the needs in our community, about the food needs. Can you talk about the needs in our community? Are people getting what they need? Do you see some needs in our community that aren't being met?
Well, as everyone can imagine, our social agencies have been getting hit really hard by people who, the less fortunate of our community that really need the help, such as agencies like the Salvation Army and Council Community Services. We stay in touch with the staff at the Council Community Services, and they said, they gave us some statistics that numbers are up. They've had just this month 50 or more calls for rent and utility assistance. So, and their shelter's open 24 hours a day, and it's almost full, but they are trying to keep some room for quarantine if one of their but they're serving more people than ever. They're expending more funds than ever to keep their food up in the pantry. So of course they still need assistance. They said they have been getting generous donations, but they will need more as this continues. And so I hope that people do think of them, the Salvation Army, and any other social agency that really needs help in this time. And Gillette and Campbell County always come through, and so that's wonderful that we do live in such a giving community.
Absolutely. And I know that it's in times like these that people get a little shy of being generous, a little shy of giving away. But if you are one of those who have enough for yourself, I would ask that you consider just being a little bit extra generous with those who are struggling in this time. All of us know someone who could use a little bit extra help right now. So I just want to say, if you have an elderly relative, go grocery shopping for them. If you know someone who has COVID-19, keep sending them messages of support. I love all the parades and all the other creative ways that people have been showing support for each other. So let's just keep coming up with creative ways to support our first response, people who are struggling. Well, let me say welcome to all of our panelists. Thank you for leading us through this. Thank you for your leadership. And we will continue to pray for you. We will continue to follow you and believe that God is leading you in the right direction. Thank you for joining us. And thank you for those of you who watched. Please stay safe and stay home.